Hello, everyone, and welcome to the online asynchronous lecture for week 9, lecture 9 of Pathophysiology for Massage Therapist 1. I'm going to start with the lecture in just a moment. I'm going to share a screen. We're going to go through these conditions, and I'll tell you what is due after the fact. So here comes the share. Everybody should be able to see the screen. It's fairly clear and straightforward. We're going to continue working on conditions regarding the skin. We're going to start off today's lecture, We're going to start off today's lecture with dermatitis. Dermatitis is going to come in a few different variations, depending on what is going on with the individual's body. The word dermatitis is a name for any non-specific inflammation of the skin. A lot of different things can cause inflammation of the skin. All of those inflammations could be called dermatitis. There are a few major types that we should be aware of. One of the most common is called contact dermatitis. That can be caused by physical contact with a causative agent, either an allergen or an irritant. We talked about those a little bit before. Allergens affect only people who are susceptible. Irritants affect everybody. Poison ivy would be considered an allergen, whereas lye, L-Y-E, lye, would be considered an irritant. We also have seborrheic dermatitis, we'll talk about in just a moment, as well as atopic dermatitis, also known as eczematicus dermatitis, or eczema for short. Contact dermatitis, caused by either irritants or allergens. We see this as a localized rash, possible redness, swelling, possible vesicular lesions, or oozing. I mentioned poison ivy being a type of a contact dermatitis or a rash relating from things, but also we see it with allergens, people who are allergic to nickel, getting a little red irritant spot where the button of their jeans touches their skin, for example. Folks with contact dermatitis will need to clean their skin because whatever irritant or allergen is on their skin is causing it. Some localized steroids like a bacitracin or a triple antibiotic might be needed there, but topical steroids are also specifically advised, as well as antihistamines as needed. A contact dermatitis is going to rate as a local contraindication because the irritant or allergen may be spread due to excessive contact. If it is seborrheic dermatitis, that's where inflammation causes the change in oily secretions from the body, specifically sebum. We usually see this in places where a great deal of sebum is produced. Seborrheic dermatitis usually occurs on the scalp and in the form of dandruff, which is a very notable type of seborrheic dermatitis. Seborrheic dermatitis is going to present with scaled flesh. Things are going to be scaly, possible flakes. There might be inflamed skin underneath. Mild itching or burning might be present. Seborrheic dermatitis is actually quite common. There are a number of over-the-counter medications and shampoos specifically for dandruff geared toward this situation, either containing zinc or selenium to accomplish this. Prescription meds might be advised for seborrheic dermatitis, although that is only in extreme cases. Unlike contact dermatitis, seborrheic dermatitis won't necessarily get worse by massage. It can be bothersome to the individual, but if you are going to massage someone's scalp, for example, that has dermatitis, proper lubricants are advised. Frankly, most folk are going to benefit from the massage anyway. Actually, the tactile experience of receiving massage over an area that they may feel subconscious about can be pleasurable, but it may also be anxiety causing. So it's very important for you to be observant of that. Seborrheic dermatitis will rank as a caution. We also have atopic dermatitis. This rash, once again, non-contagious, just like seborrheic is non-contagious. It is linked to hypersensitivity or an allergic disposition. Sometimes this occurs due to heredity. It says maybe hereditary. We're finding a strong hereditary nature to eczema. For example, you can sometimes see it passed from mother to daughter. Again, its other name might be eczematous dermatitis. If you have seen dermatitis before, you'll note that it is marked by scaly skin. It could be crusty. It usually occurs in places where you have folds. Usually the inside of the elbow is a very common place to see dermatitis. Excuse me. The dermatitis may appear as discolored. It may be secreting fluids. It may be itchy. A scaly appearance, like I said, could be dry or leathery to the touch. It is very distinct from the other flesh around it. Treatment for atopic dermatitis usually comes down to lotions, moisturizers, possible topical antibiotics for open skin. Steroids may be used as well. As this does seem to have an allergenic disposition, you may want to advise clients or ask clients about their allergens to make sure that if you are making contact with this person, that you are not causing further outbreaks. Eczema, where the skin is broken, is a local contraindication, but in general, the condition will classify as a caution. As long as the skin is not broken, using a properly emollient lubricant should be noted and accepted. So, eczema or atopic dermatitis is a caution disposition. Next up is psoriasis. Psoriasis is very specifically an autoimmune response where your skin cells are going to produce excess skin. You're going to grow excess patches of skin. This excess growth creates thick patches which will discolor and can be found all over the body. It affects anywhere from 1% to 3% of the US population. We most commonly find it on the scalp, although elbows and knees are common, as well as the back, chest, and or buttocks are also very common locations for this condition. We do note it as impaired, as associated with an impaired immune response. The folks I have worked on who've had psoriasis in the past often get outbreaks during stressful or emotional periods of time. Excuse me. One such client did, in fact, have a huge outbreak of psoriasis upon the passing of her husband. Psoriatic arthritis can occur in moderate to severe cases. That's joint pain associated with the psoriasis. The plaques that create are elevated. You can feel a ridge on the skin. They are thick. They are redder than the skin around them. It can feel scaly. The skin can become dry and cracked. Joint pain, as I said, is possible, and itching is a maybe for psoriasis. Once again, this is not a contagious disease. This seems related to an immune response or even an autoimmune response. Treatment for psoriasis is usually topical meds with vitamin A and D. You've possibly heard of vitamin A and D ointment. That would be an example of a treatment for psoriasis. However, we are not allowed to administer that ointment, and you all know why. Laser therapy, called phototherapy, or UV therapy may be advised. Moisturizers, of course, antihistamines for a stimulated response. And if it is internal stress that's leading to it, cannabis is considered one of the primary treatments for the anxiety that may bring on psoriasis. As of recently, we have seen the disposition on psoriasis change. And you'll note that I'm making this change on your set of slides right now. Areas of broken skin are a local contraindication, but doctors are starting to advise massage for regular treatment of psoriasis. So we're seeing this one change to an indicated and changing right in front of us. Make sense to everyone? Good. Next up is a condition that New York State loves to ask on the state boards, and that is impetigo. Some people will call this foot and mouth disease. You may have heard of it called that way. It's a bacterial infection around the mouth, nose, and other skin folds. We see it usually more common in children because their immune systems haven't picked up yet, and it is highly contagious. So contagious. It's most commonly caused by a staph or strep bacteria. As stated before, there are those common conditions. Can be spread by direct contact or by handling contaminated objects. So yes, this involves scrubbing your room. Vesicular or pustular lesions will develop, specifically a yellowish brown crust may develop around the mouth. Feel free to Google other images of impetigo to see this. It may progress to fever in the enlarged lymph nodes. It is commonly treated with antibiotics, topically and orally, and as well as the isolation of contagious materials. Anything that was touched by this person may need to be completely disinfected or, in some cases, destroyed. Impetigo is exceptionally contagious, and as such, I'm sure you probably already know what the disposition is going to be. This one is a full contraindication. It's asked on the New York State boards because it is always, always, always a full contraindication. Very good. Moving on, we come to herpes. Herpes comes in a lot of different variations. We're going to focus specifically on herpes simplex. Herpes simplex is often named for which part of the body it is going to affect, and we'll talk about that in just a moment. It's a common virus affecting about half of all Americans in one form or another. That number may actually be a little bit higher than half. Herpes virus is recurrent, affecting skin and mucous membranes of the body, and it will relapse or it will draw down on its own. It is self-limiting in that way. Most common types of herpes simplex are oral herpes, which we saw in the previous slide, also known as a cold sore. We also have genital herpes. You can guess where that is. Herpes whitlow, which affects the fingers and the fingertips. Herpes gladiatorum, which affects the body and usually is contracted by wrestlers, as well as herpes psychosis, which affects the beard line. There's also the misfortune of having ocular herpes, which affects the eyes. Here's an example of some oral herpes, along with herpes whitlow, and in the beard line, herpes psychosis. Herpes are transmitted, herpes are transmitted by skin-to-skin contact or by contacting a contaminated surface like a door handle or a toilet. While cold sores are most commonly found in the face and mouth, any open skin can contact herpes in other locations. If you have cuts on yourself, that's where we will most likely see herpes. Signs and symptoms are these fluid-filled vesicles, which erupt with yellow fluid and eventually form a crust. The condition, like I said, will heal itself and recur at times of stress. There is no cure for herpes, although the outbreaks will be limited to the area that are infected. Disposition on herpes, because a herpes sore is actively, is actively a contagion. The disposition is going to be a local contraindication. When the condition is in remittance and no sores are present, you may resume massage over the area. Herpes simplex is a local contraindication. Pressing on, we have chicken pox and shingles. They are caused by the same virus. Chicken pox and shingles are both caused by the varicella zoster virus, also known as herpes zoster. It's a common childhood malady. It affects roughly 120,000 Americans each year, mostly children, like I said. When I was a kid, it used to be that you were sent over to someone's house for a chickenpox party. The kid was sick and your parents sent you over there so you could catch it too, because contracting this disease does provide immunity against contracting it in the future. That's why they'd want you to catch it early. The older you get when you contract chickenpox for the first time, the harder it hits your system. As a child, you're on the couch for a while, you eat some soup, you have some Jell-O, and you feel better in about a week, week and a half. As an adult, you may be hospitalized with this disease. It is of note that in 1 in 10 cases, the dormant virus may become activated later in life due to stress or trauma. This reactivation brings on similar symptoms and is called shingles. People with shingles are, in fact, contagious. And if you have not had chickenpox, you can contract it with someone with shingles. Here's a look at chickenpox and or shingles. This is probably chickenpox, guessing the age of the child we're seeing there. Disease begins with a headache and a loss of appetite. Mild fever will be present, and then we'll see the development of lesions, clear on red skin. If you see a rash of this nature, you don't have to presume that it's chickenpox. Just know that it's going to be quite an angry rash, and you will know it when you will know that it's a rash when you see it. There may be hundreds of such lesions all over the body. The condition usually takes about 2 weeks to heal. Shingles will have a recurrent symptom associated with a compromised immune system response or stress. Those outbreaks tend to be localized to a dermatome where the virus is still effective. Older adults are more susceptible to shingles and will fare worse from the symptoms. The treatment for this, there is none. It's a virus. The body will heal itself over time. There is, I know, a chickenpox vaccine now. It is about 80% effective, which is not bad. And folks who take the vaccine are much less likely to get shingles. So it's something to keep in mind. Bottom line, can we massage someone with chickenpox or shingles? Some textbooks will advise extreme caution. Others will recommend complete contraindication until the symptoms have abated. I'm going to go with the contraindication. We're going to call this a capital C. This is a contraindication. Next up, we have warts, also known as verrucas. Warts are a viral infection of the skin caused by the human papillomavirus, HPV. Life Science reports that some 70% of Americans are infected with some form of HPV. We all likely have some warts somewhere, or may have had warts somewhere. I certainly had some on the bottom of my feet when I was a teenager. We'll get to this. The most common form of this disease is a common wart. Plantar warts are also remarkably common in rural environments. I grew up in a farm town. There you are. A common wart, also known as a verruca vulgaris, found usually on hands, knees, and elbows, presents as hard, flesh-colored, flaky nodules, much like you saw there. You can also get them on the bottoms of your feet. Those are called plantar warts for obvious reasons. Sometimes people will confuse those for calluses, but they are in fact warts. Sometimes you will find plain or flat warts on the face or legs where shaving happens. Filiform warts, those tend to be long and hanging warts. They tend to be more narrow. They can be found on the face, lips, and eyelids. Many of us have an aunt who has a filiform wart. Probably the most famous kind right now is genital warts. HPV can lead to genital warts, which is a sexually transmitted infection, which can lead to cervical cancer, hence the HPV vaccine. Warts occur due to skin-to-skin contact. Many variations of the virus occur, leading to many types of warts. All warts can be called verrucas. Those of you who have seen Willy Wonka and the Chocolate Factory or read the book, you know that one of the young ladies is named Veruca Salt. Her name is Wart. Signs and symptoms of warts, we will see a rough, raised oval mass on the skin. They generally don't cause pain. They're just viruses living on you and feeding off of your nutrients. They are usually treated in a number of different ways. They can be treated with over-the-counter meds, which usually don't work. They can be treated with salicylic acid, which usually doesn't work. Pads or cushions to prevent any discomfort if it's on your feet. Freezing, which usually doesn't work. Laser treatment, which works a little bit better. And the one tried and true way to get rid of warts is excision, to cut them out of your body. Those warts will tend to recur even after treatment. So, spread tactily. We know that warts are going to have to be a local contraindication as they are transmitted skin-to-skin contact. If you see a wart on someone, you should not touch them. Otherwise, you can catch warts. Warts should be covered during treatment, and if you accidentally contact one, go and scrub yourself thoroughly after that massage, which I know you will do anyway. Next up is rosacea. Rosacea is also sometimes called acne rosacea. And the reason for that, it is usually occurring on the face and does present with an irritation of the skin. Rosacea is a progressive inflammatory disease. It gets worse as life goes on. It can be localized or it can be systemic, but usually it affects the face and the neck and possibly, in my case, the eyes. It's most commonly found in fair-skinned women between the ages of 30 and 60. My mother had it rather severely. There are about 14 million cases in the United States. Heredity and environment are thought to be causative. There are things that will make the condition worse, and those are things you should learn about and avoid in your life. But heredity is in play. You can catch it from your parents. The signs and symptoms of rosacea is persistent skin redness, usually on the face, dryness and warmth, swelling and thickening of the skin. The skin will become a little bit thicker. Telangiectasia, once again, those are spider veins, broken spider veins in the area. Ultimately, the development of a red bulbous nose, a condition called rhinophema, may occur with pustules developing on the skin. Rhinophema is where the nose becomes enlarged and deformed. Rosacea is treated with topical agents and avoid the things that could be making the condition worse. That can be challenging if it's something like a particular food, but you do need to be aware of it. Acne rosacea rates as a caution. Avoid any techniques that generate heat. So effleurage over an area where rosacea can occur can cause irritation, so you avoid it. Also be observant of any pustules. You want to give those a wide berth. Acne rosacea rates as a caution for disposition. Now, for a couple of rarer conditions for you to observe. This one is called pityriasis rosea. Pityriasis rosea usually occurs during the winter months. It usually affects fair-skinned people and most common between the ages of 10 and 35. It is not contagious, but I will explain. It's thought to be associated with certain viral infections. It is basically a skin reaction. We usually see it in colder climates. The lesions are itchy and will eventually go away themselves in 8 to 12 weeks. Can be treated with the itching can be treated with antibiotics or steroids, but ultimately it's just a skin reaction to a viral infection. I had it when I was in college. It's not a particularly big deal. It's just something that can occur and go away on its own. Self-limiting. However, it is a reaction on the skin, and it is thought to be viral in nature. So we do consider it as a local contraindication. We don't want to necessarily spread this on the body. Again, this is going to be very rare. You're unlikely to run into a case of pityriasis rosea, but it is a local contraindication. Very good. Next up is a fun one. That is lichen planus. Lichen planus is an inflammatory condition of the skin and mucous membranes affecting the trunk, forearms, wrists, legs, and ankles. We usually associate this with exposure to radiation, which can lead to it. The average duration of lichen planus can be up to 1.5 years. Recurring episodes may occur. It usually occurs later in life, and the hyperpigmentation that occurs with the disease will remain after the disease has healed. Radiation has been found to be a link with this, as well as certain chemical exposures. It is linked to an immune response or an allergic response to the stimulus that causes it. The rash will contain flat-topped red papules. Actually very dark red. It can be as dark as violet. Can affect your nails. Your nail beds may split. You might develop ulcers on the area affected. Again, we saw that on the wrist of the individual before. Hands and wrists are a normal place to find this. It is self-limiting. It will only go as far as the exposure was occurring. Antihistamines and steroids might be needed. Phototherapy to repair the skin may be advised. Again, this is a fairly active condition. I'm going to recommend local contraindication until it's completely healed, but I would accept a caution if you want to train in this direction. Be mindful of sensitivity. If the tissue is excessively irritated or itchy, you should probably be avoiding it anyway. So that comes down to a local contraindication, but like I said, I will accept a caution if you provide it. We also have scleroderma. As the name implies, sclero means hardening, derma means skin. The condition is literally the hardening of the skin. This is an autoimmune disease. If it's systemic, the life expectancy is probably about 5 years. It's generally found in middle-aged women. Again, autoimmune diseases being more prominent in XX chromosome. Chronic disease is characterized by thickening, hardening of skin and the connective tissues, as stated. Cause is unknown. It's thought to be autoimmune. Skin hardening can cause fibrosis to deeper tissues, eventually affecting internal organs. The skin appears shiny and hard and stretch impaired for movement. Chronic weakness can occur. Folks may be treated with steroids and immunosuppressants. How we will identify this, it is sometimes called CREST syndrome, because the characteristics of the disease are as follows. We will usually find calcinosis or development of calcium in the tissue. We will see this associated with Raynaud's phenomenon, which is an allergy to cold. That's an extreme reaction to cold as it affects the client. We have E, which is spell it properly, esophageal dysmotility. That's a slowing of your esophagus, an inability to digest properly, slowing digestive process. S is sclerodactyly, which is specifically the hardening of the fingers. And T, which you will find, is telangiectasia, or spider veins. Sorry. With this condition, massage has been shown to improve function of individuals suffering from the disorder and will help to forestall systemic versions of the injury due to the Askew and Pool study. Manual lymphatic drainage is advised. Be sure to keep a client warm during treatment, as Raynaud's phenomenon or vasoconstriction in the extremities due to cold is common. Use hyperallergenic materials, and this one is also indicated. This is indicated with a circle around it, as it does benefit this condition. Very good. Next up, we have hives. Hives are an inflammatory skin condition associated with allergic reactions. Many of you have probably experienced hives already at some point in your life. Most are acute, they're gone in a day, and they also are known as urticaria. They can occur anywhere on the body. If you have a chronic version of hives, this is also a concern. Ultimately, if folks are presenting with regular hives, you want a little bit of medical clearance involved with that. Cold temperatures might bring it on, allergic reactions, emotional stress. Those raised welts are also known as wheals, W-H-E-A-L-S, wheals. Severe itchiness may occur. It can progress to angioedema, which is a localized swelling that can potentially be life-threatening. They are treated with antihistamines, corticosteroids, and other medical treatments. If someone has hives, it is contraindicated. If they are chronic hives, you may still be able to work on them, but it's at least a local contraindication. So in general, we call the whole of the condition a full contraindication. Very good. Last condition to learn this week is ichthyosis vulgaris. Ichthy is the Greek prefix for fish. So ichthyosis vulgaris is the common fish scale disease. It's a group of skin disorders where it disrupts skin regeneration. The built up skin cells will become thick flakes and they resemble fish scales. Possibly you have an aunt again who has a condition like this. I certainly did. This condition, ichthyosis vulgaris, is fairly common and hereditary. It can be associated with thyroid and kidney diseases, although sometimes it's idiopathic. The image, once again, will show you the rough, dry, scaly skin. That is exactly how it presents. If it's bad, you might see some fissures developing. The fissures are, of course, local contraindications. There's no cure for ichthyosis vulgaris, although folks may use creams containing acids to help slough off those dead skin cells. We are not allowed to apply said creams because, again, those are medications and we do not apply medication. The disposition regarding ichthyosis vulgaris is a caution. Avoid areas of broken skin, obtain verbal consent, and use emollient creams. Very good. For next time, we will wrap up skin conditions. If you're in the Saturday class, we will do some review of said conditions. Please look over the chapter regarding skin in your textbook, which is chapter 2. If you have any questions, feel free to email me, and I will happily assist. In your Blackboard, you will find a quiz for this information, possibly including a condition or two from the previous week. So please look that over, complete that quiz, and answer the questions on the second page. Once you've watched this video and answered those questions, you will have accounted for the missed class of that week. Very good. Like I said, reach out to me with any questions. Thank you for watching my lecture, and I will see you in class next time.